We begin again this half hour with the latest from Comox as the credentials of a third BC radiologist are now under investigation by the health industry, and now it's happening on Vancouver Island. This latest case involves the former senior radiologist at St. Joseph's Hospital in Comox. The investigation involves a licensed and credentialed longtime radiologist in the Comox Valley. The Health Ministry and the Vancouver Island Health Authority were informed late Friday by the CEO of St. Joseph's about a concern over the quality of CT scans being read by one of its radiologists. There are reports tonight the hospital was aware of this for some time. Earlier Friday, VIHA had told A News that there were no issues with the radiologists on the island as the two cases on the mainland came to light. VIHA says it's now working to identify any affected patients and will contact their family doctors and medical specialists. Late today, the health minister told us he is deeply concerned about the development and the concerns it raises for patients in the Comox Valley. If you had a CT scan at St. Joseph's Hospital or in the Comox Valley and you have concerns, contact your doctor or Healthlink BC at 811. VIHA says on the advice of the College of Physicians and Surgeons, the Comox radiologist has now withdrawn his hospital privileges at St. Joseph's. The Health Ministry, meantime, is continuing its investigation into the two medical radiologists announced Friday, one of them in the Fraser Valley, the other in Powell River. Internal reviews are being done to see whether the scans and ultrasounds handled by the two were done correctly. And now A News has learned that the Powell River-based doctor may have had previous such problems with CT scans, working in Alberta at least a decade ago. A News reporter Gord Kurbis has the story.
When she heard that a Powell River doctor was being investigated about his radiology qualifications, Barb Hoskins was shocked.
I was just flabbergasted that hearing the same story again, because this is the situation that happened in Fort McMurray 10 years ago.
Not just the same situation, the same doctor, Dr. Mansuko Parmar. Hoskins worked with him in Alberta more than a decade ago.
But there was certainly a lot of talk at the time about misdiagnosing things, that he wasn't interpreting x-rays and scans correctly, and that things that really were there he was saying weren't.
Hoskins says she's worked with Parmar at Northern Lights Regional Health Center. She spent much of her career as an emergency nurse in Fort McMurray. She claims Parmar left the hospital there to receive training in BC. There's been no comment from Alberta health officials. She says she is shocked to learn he is responsible for people's scans again and facing the same questions.
I don't like to think that he's doing it intentionally. I just don't like to think that. I can't see that he would. I hope not.
Hoskins is wondering how Parmar was hired in Powell River, given the concern she says existed in Fort McMurray.
I wonder how he got into the place where he is. If he wasn't practicing properly in Alberta, how did he get into BC?
It's the same questions the health minister is also facing.
I think in the case of the radiologist in Powell River, there was a letter that came from a member of the opposition that was referred to the College of Physicians and Surgeons at the time, which is our standard practice. So it is not the minister or the ministry officials that have the qualifications to determine whether or not a doctor has the experience and the training necessary to practice in British Columbia. That is the responsibility of the College of Physicians and Surgeons.
Hansen says the ministry is taking steps to ensure health professionals in BC hospitals are fully qualified to be there.
I don't know that, and that again is part of what Dr. Cochrane will be looking at, but I can tell you that the College of Physicians and Surgeons, I think, is equally as concerned about this situation as I am, and I think that the public in British Columbia have a right to know that every doctor that's practicing in British Columbia has the credentials, the training, and the experience to do that job.
In the Comox Valley, Gord Kurbis, A News.